So good afternoon, everybody, and welcome again to this important conference. I think we just had a great challenge there from Rebecca. People with rare diseases are still waiting for things to get better for them, and hopefully this is going to be the way forward for things really to change over the next 10 years. I was a research advisor on the Rare 2030 study. I wasn't one of the main researchers, but you're going to hear from several of the main researchers commenting on recommendations specific to their area of expertise as we go through this presentation. So the first recommendation in itself is just a crucial and game-changing one. The Rare 2030 Foresight Study feels that there should be a new policy framework for rare diseases. You may think that's obvious, but actually it's not. It's taken a lot of decision making and a lot of thought to show us that without a new policy framework, it's going to be really hard to work together. And working together is how rare diseases move on. Working together is how we really make a difference for people whose conditions are among the rarer of those in the communities. We can see that the recommendations are comprehensive. We can see that they've taken into account so many different thoughts from so many different areas. We can see that they propose updates, adaptations, and replacements of current strategies, some of which have been hugely successful and others where more input is needed. We have a roadmap. That's an exciting thing to have, a roadmap with deliverables and dates and milestones. We believe, and we've had input from new generation into these recommendations, that these recommendations should be fit for purpose for the coming years, taking into account not only what we've already been able to do, but also all the upcoming new technologies that are coming online now. It's a framework which will only work with the support of member states and European countries. And we really want to show that it can change outcomes and change the way that people with rare diseases are living with their conditions over the coming years. You've come across these frameworks before, these scenarios. It may be if you were part of the ECRD last year. The whole of the Rare 2030 framework programme was thinking about, where should we be going in terms of the kind of health system and the kind of situation which will best support patients with rare diseases. And it was very clear from that input from across the board that rare diseases are a particular area where we need social justice. We need collective accountability. We need patient-led innovation. If we go only on the road for individual responsibility or market-led innovations, then patients with rare diseases are once again going to be left behind. Because without that collective thought and that collective accountability, we are really not going to make that progress. And therefore, investment for social justice is the guiding principle and the guiding scenario within which these recommendations sit. There's a little bit more that you can hear about that now in this short video.
If we prioritize societal responsibility, equity, and the collaborative policy frameworks to achieve them, we will end up in the investments for social justice world, where major investments have been made by governments and are fairly shared across Europe, ensuring health and well-being of all European citizens, and equity for vulnerable populations, including those living with a rare disease. The European Union's increased legislative power in areas of health and social welfare fosters access to care, treatment, education, employment, leisure, psychological support, and reduces the risk of being left behind no matter where you live in Europe. Healthcare systems are led by an understanding of a holistic view of a patient's needs, including the curative, but also the preventative, rehabilitative, and palliative. This understanding is based on comprehensive health data collection, seamlessly shared across borders in a system also designed to integrate data from consumer and profit-driven companies. Multi-stakeholder initiatives prioritize investments in rare disease research that responds to patient needs. These efforts cover as many diseases as possible. The resulting innovations are regulated and assessed at the European level and with greater transparency, accountability, cost-effectiveness, and consideration for the patient experience. With the right public and private partnerships, the field of rare diseases could play a pioneering role in promoting such a deep, positive change in European health and social policy for all citizens.
So, the recommendations themselves. Now that we understand a little bit more about the framework in which we want these to operate, Let's go in a little bit more detail into this whole range of areas that we want to see embodied in healthcare policy across Europe, both at a national and an international collaborative level over the coming years. For each recommendation, there's been a really huge amount of consultation and a whole amount of thought and a whole amount of synthesis of where the best prospects lie. So a specific issue has been taken into account in terms of thinking about the Rare 2030 goal and vision, panel of experts, the Rare Barometer's Voices survey, and very importantly, a young citizen panel have all fed into what the recommendation should be, and crucially, how we get there and how we monitor success. Some of this is in the executive summary, which you have access to through the website, but the whole recommendations document is well worth a read. There's lots of detail in there, lots of fine granular information that you can find.